Okay, good afternoon, everyone, and welcome to this handing off event at the Ministry of Health. We have here with us some esteemed guests who have been supporting the ministry for a number of years. His Excellency Dr. Srinivasa from the Indian Eye Commission, who's the Commissioner of the Indian Eye of India. We have here with us the PWR of PAHO, Dr. Kadina, who's just joined the PAHO operations here in Guyana, followed by our Honorable Minister, Dr. Frank Anthony. The purpose here today is to do a handing off ceremony of some very important equipment and supplies to fight against the COVID efforts. They include things such as the ventilators, we have oxygen concentrators, and examination gloves to provide the supplies that are needed. I will have the representative from each one of the agencies speak a little bit more about these important supplies to the ministry. On behalf of the ministry and the accounting officer, we thank them very much for providing these supplies at this critical time.
Today we have gathered here in furtherance of our previous handover, wherein as part of the US $1 million grant from India to Guyana to fight COVID, we had announced the grant of ventilators, gloves, masks, and other equipment to fight COVID. So today we are handing over 21 ventilators and 315 boxes of gloves for use in Guyana. As I had previously mentioned, India really is taking a role of a world leader in fighting COVID. Our Prime Minister Modi has been at the forefront, and we have so far helped over 100 countries in combating COVID through medical supplies, supplies of PPEs, and now India is at the forefront of working on the vaccine. Currently there are 3 vaccines in various phases of the trials, and we believe that in early 2021 we should have a working vaccine. As you all know, this pandemic has changed the way the world has to proceed, and the Indian healthcare and pharma industry has been at the forefront of meeting this challenge. I would like to reiterate that India and Guyana share a very historic relationship, and we want to work further in strengthening this relationship. Especially, we are going to work on the 3 regional hospital upgradation at Sadi, West Demerara, and Bartica. I had the opportunity to visit them a couple of weeks back, and we believe that these hospitals really need upgradation, complete refurbishment, and we hope that we will be able to work on them pretty soon. So I would like to thank the Honorable Minister for having given me the opportunity to be a part of this function. And Mr. Kadina, welcome to Guyana. This is a great place to live in, I can say, and we have lots to do together. And of course, as they say, you can clap only when both hands meet. So we will work very closely with the government of Guyana on this. Thank you, one and all.
We as PAHO, as you know, we are a technical cooperation agency from UN. We are very pleased to give this medical equipment to the Guyanese people. It's 24 concentrators of oxygen and 5 ventilators. Of course, this is for moderate and very people who are in very, very bad situation in terms of the illness. As you know, this is a pandemic, so to have all this material, all this medical equipment, it's a really difficult process of purchase, because all the countries in the world are buying this kind of material, so it's not easy to have, and it's very important to have all the support in terms of financial, to have the possibility to access of this medical equipment. The freight of this equipment to arrive to Guyana also is very expensive. It's one of the most higher that we saw in the history, because there is a small groups that are working in this kind of transportation all around the world. So I think it's very important, and it's an important issue that Guyana has this, all this material and all this medical equipment to be better prepared to take care of all the Guyanese people that has infected or is in a bad situation in terms of the COVID-19. I think that this is not only for COVID-19. All this material will support to strengthen the health system of Guyana. It's not just for COVID. Yes, for COVID, it's a very important response, but fundamentally is this, all this material will stay at the health services and will support other people that has other problems, tuberculosis, asthma, and other pulmonary infections, and not only the COVID. So all these mechanisms also are supposed to strengthen all the health system in this country. So it is very important. It is very important also to train all the people who will work in this, and I know that the ministry will do it very, very well, to support them and to be very, very well prepared to respond to this COVID-19. Thank you very much, Honorable Minister, Your Excellency.
The government of Guyana, the Ministry of Health, truly appreciate this donation. As High Commissioner of India said, we were given $1 million US by the Indian government to assist us in the procurement of vital medical equipment. And we have received the first set of 5, which upon the receipt of those equipment, we sent them to the Georgetown Public Hospital. And now we are happy to receive the additional 21 ventilators. So this is certainly going to improve the facilities that we have in our ICU. And what we are going to do with these equipment is not just to have them at the Georgetown Hospital, but we are also going to decentralize some of these equipment. Our intention is to have some capacity at the regional hospitals as well as the Georgetown Public Hospital. In addition to that, over the last 2 or 3 days, we have been working to get the ICU at the Ocean View facility up and running. So some of this equipment would also go to the Ocean View facility. We are also very grateful that the relationship between ourselves and the government of India, that through that relationship, that we have restarted the program for those 3 hospitals. And High Commissioner, I'm very happy that you have been able to visit those sites so that you know that we urgently need to refurbish the West Demerara Hospital, Soddy Hospital, and Bartica Hospital. We were very pleased that when we took over the government, we had those initial discussions between yourself and His Excellency the President, that you readily agreed that you're going to ensure that this becomes one of your priority. And since then, we have advanced very rapidly, and we expect that early next year that we'll see the start of these projects. We are also very pleased, and you have repeatedly said this, that India is at the forefront of getting the vaccines going. And you know, every time you say that, I also would say to you that when those doses are ready, if we can have some of them come to Guyana. And I'm sure you'll do your utmost to ensure that we are able to get some of those vital supplies come to Guyana as well. But it shows that we have a very strong and vibrant collaboration. And we look forward to strengthening that, and we look forward to having other types of partnership as we move this relationship between Guyana and India forward. Our technical partner, PAHO, we want to welcome you, Dr. Cardina, to Guyana. And as we have a very strong relationship with PAHO WHO. You have been, at the center of this fight for us. You have provided a lot of technical support to Guyana. And also, when we were in dire need of equipment and so forth, that the organization stepped forward and assisted us to procure vital supplies, PPEs, ventilators, and other types of equipment, so that we can help with getting these into our hospital and provide the kind of quality care that is necessary for our patient. We are extremely pleased that today we are receiving a number of oxygen concentrators. And why this is important? Because the Ministry of Health, we spend literally millions of dollars in oxygen for our patients. And we have to buy these oxygen in cylinders and then put it at the hospital, and it costs millions and millions of dollars. What these machines would do for us is that it takes air, ordinary air, and would convert that or concentrate that into oxygen. And so what comes out of the machine is oxygen. So from ordinary air, we are able to produce oxygen for our patients. This would be extremely helpful in the interior of our country, especially places like in Region 1, Region 7, Region 8, and Region 9, where it is challenging for us to take oxygen into those communities. So by having these oxygen concentrators, it would help us greatly with our patients who would need that type of service. So we are extremely grateful to you for providing us with these oxygen concentrators. And of course, you have also provided us with a number of ventilators, I think 5 more ventilators. So this would add to the complement of what we have. We have come a long way since 2 months ago, because 2 months ago we had just about 2 or 3 ventilators at the Georgetown Hospital that were available to COVID-19 patients. And with this amount of ventilators that we now have, not only would we have ventilators at Georgetown Public Hospital, but we'll have for Ocean View, and we'll be able to send out to the region. So this is going to make a big difference, a huge, huge difference to how we care for patients, especially in the region. So I want to thank both PAHO and the government of India for this kind gesture, but this would make a tremendous difference to the people who are sick and who would come to utilize our facilities. So a big thank you to you, and we continue to rely on you for this type of collaboration. So thank you once again.